Well, I think what we have ahead of us right now is a monumental amount of data. So I think, the real world data that's being generated from all different sources, whether that's from patients themselves and devices that they may be using, or electronic records or claims data, it almost doesn't matter. The volume is just growing so exponentially that we actually are ahead of ourselves in thinking about how we could actually turn that into evidence. So I think we're a little ways from that yet, and so I think the benefits actually are that we should take a step back and recognize these digitally native data sets that we're collecting from many situations never existed before. And so we need to be thinking about what are the ways that we can start to harness the power of the data first, empowering the data actually to start answering questions that could be better understood once we know what the evidence is we're trying to generate. So I think we need to be careful not to suggest that real world data is going to translate into real world evidence without some fair amount of work in between. So I think between the benefits of having more access, greater integration of a variety of different data sources coming together to really form a more holistic picture of a person is incredibly wonderful, and I think people will welcome that. It's the other side of that to say, then how can all of that information become meaningful to me when I'm trying to make a healthcare decision, or when my clinician is trying to help me with a healthcare decision. I think in light of where we are at ISPOR and the fact that there's been such a huge advances in the last number of years in recognizing that people have preferences around the care, and not only the care but also the research they want to participate in. And I think what we're seeing here and recognizing here this year is that it's finally starting to resonate in the research and the clinical community in a way that people are embracing it. They want that kind of partnership. So I think I was on a panel this morning that asked whether or not we're at an inflection point, particularly around transforming digital health into something that actually can inform on real world evidence. And I do think we are. I think we've gotten to the point where patients and people are more engaged in their health. They have more tools that can help them have that kind of experience with it. Now we really, as I said earlier, we need to empower the data so that that data becomes more meaningful in their daily lives. And I think that would be something that ISPOR, as an organization, can help advance in the kinds of work that it does and the research it supports.